Hey there, welcome. If you enjoy educational content about sex, sexuality, and relationships that inspires and informs, be sure to like this video and subscribe to the channel so you don't miss what's coming next. Also, please drop a comment to share your thoughts and questions. Hi, welcome back. I'm so glad you decided to join me for episode 3 of talking about sex issues for helping professionals. Today's topic is working with common client reactions, how to handle them. Let's imagine you decide to raise the topic of sex in the course of your work. Good for you. Now, I want to help you prepare for some of the responses you might hear so that you feel confident that you're ready to handle them. I think that's a really important piece of being willing to run the experiment of asking in the first place. To be clear, the things I'm going to be talking about in this episode are not the most common reactions. By far, the most common reaction is very positive. It comes in all different varieties, but I would say there's at least an 80% chance that you're going to get a very positive reaction. Thanks for asking. I really appreciate it. Nobody ever asked me about this before, and I can see that that's important. There's not really anything for me right now. Or, wow, that's an interesting question. My family never talked about it, and honestly, my partner and I don't really talk about it either. Maybe it'd be a good idea to look at that. Or, now that you mention it, there is something that I have some questions about. Or, we often do fight about sex. Might be nice if we could do better with that. Sure, let's talk about it at some point. Or let's talk about it at some point, but right now I want to talk about this, which feels more important to me. This is all stuff I think you can handle now. So that's amazing. So today, where my focus is going to be is about the really unusual reactions and responses that therapists worry about. This is the stuff that if you felt confident that you could handle it, it would make a real difference in your willingness to give it a try. So let's just start with my most usual opening question, which I generally use in the very first session or even in the consult call. Is there anything about sex or sexuality you think you might want to talk about in the course of our work together? First, the one reasonably common response is no, not particularly. Then I just say, great, just so you know, if anything comes up in the future, this is a safe place to talk about it. And then I just move on. It's a non-issue. It takes 2 seconds. But what if you're worried that they might be really weirded out? They say, ew, I think that's totally weird that you asked me that. That feels icky to me. First of all, I want to say that almost never happens. Most people are actually quite relieved by the question, even if they don't have anything specific they want to talk about. It's pretty rare to actually have the opportunity to speak openly about sex in a non-judgmental environment. So in this case, when somebody says, ew, gross, again, I would just move on. I might say something like, thanks for sharing. I appreciate your honesty. And then I probably would add, the way I see it, sex is a normal part of life, and lots of people have some kind of sex-related challenge at one time or another. I just want you to know you can discuss it here if anything comes up. If not, that's totally fine too. By the way, clearly this particular client example doesn't have good role models for talking about sex in comfortable and boundaried ways. You've hit some sort of a nerve. And so by bringing it up and then saying, I think this is a normal part of life, and then saying, we'll talk about it if you want to talk about it, and otherwise we won't, you've given them an enormous reparative experience, even if a somewhat uncomfortable one. So there are some pieces to this that I think it's worth highlighting. When they expressed no thank you and you backed off, that's great. And that's reparative. And when you mention this is pretty normal life stuff, that's reparative. And when you say, I'm here for it if it comes up in the future, that's reparative. So if this is the response you get, it might be uncomfortable for them, it might be uncomfortable for you. And what I want to say is, well done, you. Gold star. Therapists often ask me, what if I have a long-standing client that I've never asked about sex before? How can I start the conversation when we're way into the work that we're doing together? I would say, no problem, just be transparent. Say something like, hey, I'm realizing we never talked about sex. Is there anything related to sex or sexuality you think you might want to discuss? And then proceed as you would for anyone. Now, here's a thorny one. Some people worry, what if I bring up the topic of sex and that leads to my client hitting on me? They say, now that you mention it, I'm very attracted to you. Thank you for bringing it up because you're hot, or some version. Yes, this does sometimes happen, but it doesn't happen as often as you might fear. And here's my main message about it. I don't think it happens because you brought up sex. It can happen whether or not you're bringing up sex. Talking about sex makes it something you can have a conversation about, though, which is a good thing. And it might take a little practice on your part, and that's okay. You can mentally prepare for this. You can rehearse it. You can rehearse every single response that you're not confident that you could handle until you and your practice partner, colleague is able to come up with some kind of response that you can feel grounded in. So listen to your gut, set yourself up so you feel safe in your space while avoiding perpetrating sexual shame. Listen to your gut and set yourself up so that you feel safe in your space and you want to avoid perpetuating sexual shame. For example, I'm careful not to imply that being turned on in therapy or by your therapist is some sort of evidence of pathology. It's all right. My assumption is that they just need some information, or they've never talked about sex in a comfortable way, or they don't realize that it's possible to talk about sex without having sex. There's a great big growth opportunity here. This is someone who really needs a safe space that is therapeutically oriented to learn more about how sex and consent actually work. So here's an example of one possible response. And there are so many different ways that this could look that there really literally are millions of different responses. But I might say, for the piece of education that I want to do, this is a relationship and a space where we can discuss anything. But before we dive into a conversation here, you should know the limits of our relationship. Ethically, there can never be any social contact outside of the therapy room or any physical contact between us at all. Now, what exactly you say here will be guided by your particular professional ethics. Mine is guided not just by being a marriage and family therapist, but by being a certified sex therapist, certified through AASECT, the American Association of Sexuality Educators, Counselors, and Therapists. So I'm going to just give that piece of information so that we have a boundary. You can also give a piece of information that's based in your particular take. So let's imagine that your licensing requirement ethical guidelines say you can't have a dual relationship for a particular amount of time after the treatment or something. You might or might not ever be interested in having a dual relationship. And so I would personally, I am not interested in having a dual relationship. I think it carries such a lot of potential for harm to the client that I'm going to say, this is not something that's ever going to be possible with me. And I'll be clear about that, but I want to be warm and clear. And I'm always holding it as an important goal of mine to not shame somebody about sex or sexuality. So no harm, no foul. Here's some information you need. Now, what the heck is coming up for you? Because it appears that there's a lot here. So here's another piece that I think is important, which is a piece that has to do with the nature of a therapeutic relationship. Now, here I'm really talking to therapists and most coaches. and some other kinds of helping professionals as well, but not all. So you're going to have to think this through for yourself, depending on your professional position. But for a therapist, the relationship between us is all about them. So I'm holding up a mirror. Everything that we're talking about is ultimately about them, their perspective, their thoughts, their feelings, their desires, their blocks, them. Even if I talk about the interaction between us and how it is for me, it's in the service of their growth and development. So sometimes it's helpful to get a little feedback. It's not comfortable for me to fill in the blank. It's not appropriate in this particular context for you to put your hand on my knee. We don't do that here. Ethical guidelines and personal preferences, whatever it is. So you're going to want to talk a little bit about the nature of this relationship. It's all about them. I have very little kind of to do with the actual relationship. So my client might project on me, they might make an assumption about what I think or feel, and I might clear it up for them, but I'm more likely to ask if they're interested in a relational stance where they're curious about what's actually true for me, and then I'm honest with them. So if somebody says, my assumption about you is you make a whole lot of money, I am less likely to say whether that's true or not, and more likely to say, I think you just made that up because there's no way you could possibly know how much money I make. I'm curious if there's a part of you that's willing to let me into this conversation as a real person with a particular perspective, me, because otherwise it's really just about you and you. It's you and what's going on in your head and your thoughts and feelings and assumptions, which is fine. And you can stay there if you want. But if you want to grow the ability to be in a conversation with another person, rather than making an assumption about me, maybe you ask me a question. Now, therapists ask me all the time, what do I do if they actually do ask a question? How much money do you make? Well, you get to be a real person. You can say, I'm not interested in sharing that. And you've still made the point, I am a human being with thoughts, feelings, and preferences. And if we're in a conversation, then we're both in the room in a particular way. And sex is not a way that we will ever be in the room together. So I imagine that that may have brought up lots of questions. I hope I get to answer them for you at some point in the future, but I'm going to move on with this theme of transference and countertransference. What happens when the client feels an attraction to you and it's hard for you to handle that? Theirs is the transference, yours is the countertransference. Okay, so their attraction to you is mostly not about you. They probably know almost nothing about you. It's probably much more about how they feel when they're with you. And think about it for a minute. I hope, I imagine that they feel seen and heard. They certainly feel centered. You're paying attention to them and you're sustaining attention for the duration of the session. They probably like how it feels to have a focus on them. They also probably like how it feels that you're not reactive and that you normalize a lot of their feelings and experiences. What's not to be attracted to? They also may have thought that sex was all about bodies and pheromones, but newsflash, it's more about these kinds of experiences of feeling seen, heard, responded to, not judged. That feels good. And so, if you're willing to talk to them about it, instead of just bailing out and saying, won't talk about it, it's inappropriate, instead, if you can talk about that, you can help them understand that give and take between partners is what makes a relationship. And a relationship is important for good sex. So you can help them learn to seek and also be in relationships that are actually reciprocal And this one is not that. They also may really need to learn to have some give and take when a partner experiences differences. For instance, differences in desire or preferences. They're interested in pursuing a sexual relationship with you. You're not interested in pursuing a sexual relationship with them. That is okay because that's giving them an opportunity to practice being in a conversation with somebody who wants something different from what they want. And that happens all the time in relationships. Okay. Um, Once I say we can't and won't act on this for numerous reasons, ethics being primary, we can then begin to explore what they're experiencing here with me that's important to them and what it lights up in them and how they'd find that in a relationship that's actually reciprocal. We can't and won't act on it because this isn't that kind of relationship, but they can learn about what's important to them and what they want in a relationship from this situation. That is very therapeutic. Now, it's also possible that maybe they just find mentioning sex to be arousing. It's certainly possible. It's what happens when there's a big taboo topic. It suddenly gets like a weird, uncomfortable amount of electricity around it. It's okay to be aroused, but how might it be getting in their way that they don't yet know how to be relational and connected without being aroused, or that a topic has that kind of power over them? Where would they like to get with that instead of where they are right now? How would they like to handle their arousal in relational and consensual ways when it does happen? So I'm also not going to say it's bad to be aroused. It's fine to be aroused. The important thing is what happens next. Well, that was a lot, wasn't it? So this piece is really worth rehearsing. If this is something that you don't feel comfortable doing, and I would say that describes almost everyone, rehearse it. Practice, 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 practice. Call your friend or your colleague, your practice partner, and get busy. So take turns being the client, explore various responses to various come-ons until you feel confident that you can keep it therapeutic, not freak out, not fire them for having sexual feelings and expressing it. Keep in mind, your client saying what they're experiencing, it's good. That's good, even if it makes you uncomfortable. The important part is what happens next. Can you take steps to get more comfortable in this hypothetical situation so that you can create a powerful therapeutic opportunity that, while it might be very uncomfortable and it might be somewhat conflictual for the client, it's extremely therapeutic and reparative because you're in the conversation rather than just reacting. So you miss an opportunity if you have sex with them, and you miss an opportunity if you fire them. So you're looking for something that actually is therapeutic and relevant here. Okay, this is a good place for me to mention that I put together a sizable resource list for you because I think a lot of what we're talking about in this video series is stuff that you might want to do some further learning about. And this topic of erotic transference and countertransference is certainly something that a short video is not sufficient for. So check out the resource list. Okay, back to my list of other kinds of questions that might come up and how to handle them, or other kinds of responses when you bring up sex. So a common one and a very realistic one is, what if it gets out of my depth? I may not know the answer to their question. I may not know how to help with a particular sex issue that they're experiencing. This is very likely. It happens to me. I don't know any sex therapist that it doesn't happen to. And if it doesn't happen to sex therapists, it also is very likely to happen for generalists. Really important for you to know how to handle this because this one is common. So there are some important things you need to know to work effectively with sex issues and to avoid causing harm by not knowing what's important. Some things are more important, some things are less important. How do you organize your treatment plan? How do you make sure that you're not essentially doing harm by missing something important? I'm going to give you lots of guidance about this, so stay tuned. And if you realize you just want to know more about sex generally, definitely check out our resource list that's included with this series. It has great recommendations for books that cover the basics and then some, and accurately at that. And all the resources on the list are really carefully vetted by me for both accuracy and for being current. But first, let's reorient to this. You don't have to know everything. I don't have to know everything. It's okay not to know everything, and we don't have to pretend that we do. Already, you're helping dispel sexual shame by talking about sex in a very clear way. You can be honest about your level of knowledge and experience and either learn alongside the client if it interests you to add to your knowledge base, or suggest they do some research for themselves and some reading. Give them my resource list and invite them to expand their understanding of the topic. When it comes to figuring out how to organize your treatment plan, and that's going to involve with sex issues, kind of sorting out threads of various symptoms and experiences so that you can get traction without missing anything important. An excellent starting point for helping professionals of any kind is my free assessment tool. Stay tuned for more information on this because it's going to help you a lot. If you find yourself working with a client who really needs someone who knows a lot about sex, you can always refer. ASECT.org has a provider locator, and that's the American Association of Sexuality Educators, Counselors, and Therapists. So at the ASECT website, asect.org, in the provider locator, you can find sex therapists, sex counselors, and sex educators. So if you're interested in the topic, you also should know you can get some extra training without becoming a specialist, and you can be quite up to date with information about a broad range of sex-related topics. I offer many trainings at all different levels about working with sex issues, and so do lots of other people. So there's no doubt that if this is interesting to you, you can pursue some learning here. You can get a little bit, you can get more, you can get more and more and more, or you can go all the way to becoming a certified sexuality professional. Now, one thing you should be aware of is that we've probably all soaked up a fair amount of misinformation about sex from our culture and our schooling, some of it quite harmful. So it's important to exercise critical judgment about what you say to your clients and which resources you point them toward, which is why I created a resource list rather than inviting you to Google. Books and web resources by ASECT certified sex therapists and educators are a really great place to start if you're uncertain that you know enough to vet resources well. Okay, in our next episode, what happens next? Step into possibility, the amazing things that can happen when we talk about sex. See you soon. Thanks so much for watching. If you found this helpful or inspiring, please give it a like. If it brought up some deep thoughts or new questions, that's great. Please leave a comment or a question. I'd love to hear from you. And if you want to make sure you're always part of the conversation, hit subscribe, and I'll see you soon in my next video.